it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is on the topic of math patterns in patient care. Now, the week before last week, I talked about the models in patient care, and I talked about the different models and some of the components of the models and examples of the models. So this week, we will be studying on math patterns in patient care. Now, specifically for this video, I'll be covering 5 main applications of math patterns in patient care. Also, I'll be adding some tools such as statistics, calculus, etc. Into this video because it's on math patterns in patient care. It's also math models, so there will be some tools as well. Firstly, the first application is diagnosis and monitoring. Now, for this application, math patterns is used for this application to analyze data such as images, vital signs, as well as lab results. So as for the images, we have cancer detection, X-rays and MRI scans and CT scans, so all over the body. So that is for math patterns. They use those scans to be able to analyze that data. So for example, the other day I went to the hospital, specifically on Monday. I went to the hospital to check my hair roots because it was falling out, because my hair was falling out so much. And they used something called dermoscopy, which was they monitored the skin. So basically what they did is that they take this little lens and they shine it into my skin and my hair roots. So what they see is that they use the system on the computer to be able to analyze and then count all the numbers of hair that I have on my skin, then on my head, and then they will be able to predict the hair growth per day, and then based on the hair length. So that is one example of diagnosis and monitoring. Other signs, other applications can be for the vital signs. We have heart rate, blood pressure. For the lab results, we have blood glucose and cholesterol. The next application is medication and dosage calculation. Now, I also went to the hospital and I had some dosages and some medications for my hair because it was falling out too much. And so the medication and dosage calculation for the applications, it will involve calculations based on weight, age, gender, and other aspects of the person's data as well. For this case, they will use arithmetic, they use ratios, algebraic expressions, etc. The third application is predictive health models. So they will examine vast data sets, for example, genetic data, health, the environment, the lifestyle choices, environmental influences, etc. And based on those factors, they'll be able to predict the patient's risk for conditions like cancer, diabetes, or heart disease, and many other diseases as well. So that is for predictive health models, how math patterns is used in predictive health models. The fourth application is treatment planning. Now, after they gather all that information, they will use math patterns to come up with a plan. So to come up with a treatment plan. So for example, in oncology, they'll use math patterns to model tumor growth to predict the optimal treatment plan to cure that tumor, for that cancerous tumor. As for cardiology, they will use the cardiologist will use computational models that will assess the effectiveness of the device that help to improve the heart function. An example of this is the LVADs, which is the left ventricle assist devices. So that is one way of, this is a computational model, that is one way that math patterns is used in treatment planning, specifically in cardiology. Lastly, is the healthcare system management. Now, of course, math patterns is used in management because it will help the managers of the hospital and the head of the hospital to be able to analyze that data and then help to manage that block flow of patients, or there's also a thing called bed blocking. So they will use math patterns to be able to model patient movements to different departments. Therefore, they will be able to use that data and then reduce wait times and bed blocking. So that is for the first one. Another use in the healthcare system management is resource allocation. So what math patterns are used for in resource allocation is that they will be able to forecast demands for ICU beds, ventilators, staff, especially in emergency situations, or staff shortages. An example of this is in the COVID-19. So that is for resource allocation. And finally, there's also the public health strategies. So doctors and analysts in the healthcare sector will analyze the disease prevalence and incidence rates, and they use that data to inform the public of health strategies to be able to cure, to be able to limit the incidence rates, and also help them to come up with vaccination schedules. So that is some of the applications of math patterns in patient care. Now, I have this quote: "Knowledge of mathematics may be the difference between saving or endangering a person's life." So I think that this quote is very true, because the knowledge of mathematics in healthcare, mathematics play a really crucial part in the healthcare sector. And knowing all the basic knowledge to be a nurse or doctor is extremely important, and this will determine the difference between saving or endangering a person's life. Take, for example, if I were a doctor and I would give a patient medication and I calculated the ratio or the amounts to give the patient wrong, then that patient will have the incorrect dosage of that medication, and then more problems will arise and they will come back to me, and I have to take accountability for that. So we wouldn't want that, would we? And that is for the health applications of math patterns in patient care. Next, for the next part, I'll be talking about the tools of math patterns in healthcare. So there will be statistics, and this will include regression models, some other models, survival analysis, etc. Calculus. This will include differential equations for modeling processes, artificial neural networks for image analysis. There's also decision trees. If you can see this on here, it's basically like a mind map. We have this, for example, I have this decision here. I will divide it into smaller parts, and that is basically what a decision tree is. And what this basically does is it helps guide clinical decisions. So it helps doctors to make clinical decisions based on other data as well. And lastly, the information theory metrics is to identify the system shifts or anomalies in the hospital. So that is for the tools, some of the basic tools that are used in patient care. And that wraps up the end of my video, my main video for this week. I hope that you guys learned something new from this video, or just review some of the things that you have learned. Thank you for listening to my video, and I hope to see you soon in the next video or the next meeting. Goodbye!